you heard live by medical doctors, medical nurses, people in the medical profession that have caught the virus, that have been infected by the virus. And you would think all the precautions that they're taking and all the things that they've talked about to prevent, and they still come up with the virus. So now Dr. Pepi, she's going to give us some specifics about the vaccine. In her presentation, she will answer some very frequently asked questions, and she'll bring up something maybe some of us have never even thought about. Dr. Pepi.
Good evening, Mr. Lewis. Good evening, colleagues. Good evening to all of you joining us. Thank you for coming. In addition to being a family medicine doctor at Mountain View Medical Group at Centennial, I am also a daughter, and here are my parents. These are my parents. They're in their early 60s, and here they are on Christmas Day 2020, visiting with my sister-in-law, who is confined to her home because she has contracted COVID-19. She is an ER nurse in Scottsdale, Arizona, and thankfully, she did not develop severe illness. You can see her here in the window, and my parents here outside. She was able to return to work after a few weeks of rest at home. Thankfully, and miraculously, my brother, her husband, did not become infected with COVID-19. They stayed in separate parts of their home, my brother delivering food and drink to her door. The two opened their Christmas gifts together in their living room, each wearing N95 masks. COVID-19 touched my family at the end of 2020, and I pray that no more of us fall ill. Here is where the COVID-19 mRNA vaccine comes into the picture. Here is where you come into the picture. In my segment of this webinar, I'll be discussing the vaccine and you. Dr. Ellison explained the development of the vaccine, and I will share how the COVID-19 mRNA vaccine works in your body. The COVID vaccine uses a code of instructions called messenger RNA. This messenger RNA allows our bodies to make a small, harmless piece of the coronavirus called the spike protein. Once our own cells make this spike protein, our immune system, which fights off infections, recognizes the protein as foreign and begins to create ways to fight it. One way is by producing antibodies, which attach to the spike protein and mark it for destruction by other parts of our immune system. In addition to making antibodies, our immune system also has white blood cells that destroy infected cells showing the spike protein. After getting vaccinated with the mRNA vaccine, our bodies have two effective ways of getting rid of COVID-19 particles before they have a chance to make us sick. As for the mRNA given in the injection, our cells break it down after a few days. Here are a couple of analogies. mRNA is like a recipe or instruction manual. It is a recipe for an outer part of the virus, the spike protein. It is an instruction manual for building the spike protein. Think of the last time you put something brand new together, like a piece of furniture or a toy. It can take a while to get the hang of it. If you made two of the same things, did you notice it took less time to make the second one? Stimulating our immune system can be like this process. The first time we are exposed to something, it takes some time to get a grip on it. The next time we are exposed to that same thing, our bodies are familiar with how to tackle it. The two-dose nature of our current COVID-19 vaccines helps our bodies build confidence in its ability to recognize and combat the virus. Here are some facts. The mRNA vaccine cannot give you COVID-19 because it does not contain live virus. The vaccine does not affect or interact with our own DNA. Our DNA lives in the nucleus of our cells, and the mRNA in the vaccine does not enter the nucleus. Any discomfort you experience after your vaccination is temporary and a natural part of the process, a sign that your immune system is working. Another vaccine is coming down the pipeline, the Johnson & Johnson vaccine. This one is called a viral vector vaccine, and it works by using a changed version of a different, harmless virus to deliver a piece of the spike protein. The viral vector that harmless virus, uses our own cell's machinery to make the spike protein, which is then shown on the surface of our cells and starts an immune process similar to that of the mRNA vaccines. It only takes one shot and is effective after 28 days. The Moderna vaccine has been approved for emergency use in people 18 years and up, the Pfizer for people 16 years and up. Neither mRNA vaccine contains eggs, preservatives, or latex. Both are safe for people with high-risk conditions like obesity, heart, lung, or liver disease, diabetes, or HIV. For the mothers in the audience, I too am a mom to two adorable children. Granted, I am biased on the adorable part. As moms, we try to protect our children in every way that we can. Getting vaccinated is one more way that we can do that, while protecting ourselves as well. If you are pregnant or trying to become pregnant, the vaccine is something that can help you stay safe. Pregnant women in general are more vulnerable to viral infections due to changes in the immune system during pregnancy. Based on what we know at this time, pregnant women who are infected with COVID-19 are at increased risk for severe illness, needing to be hospitalized, admitted to the ICU, placed on a ventilator, and even increased risk of dying from the infection compared to non-pregnant women of the same age group. Additionally, pregnant women who get infected with COVID-19 may be more likely to have premature babies. While we don't have human studies to provide more data on the vaccine and pregnancy, studies in rats who received the Moderna vaccine before or during pregnancy did not show any safety concerns. Getting vaccinated while pregnant is a very personal choice. You should know that there are many benefits to vaccination and many risks to COVID-19 infection during pregnancy. For those of you who already have your precious little ones in your arms and are breastfeeding or nursing, we don't believe that breast milk is likely to spread the virus to your baby, and mRNA vaccines are not thought to be a risk to the breastfeeding baby. If anything, antibodies from vaccination can pass in the milk and offer some protection to your baby. You may have questions about the vaccine and your fertility or ability to have children. There is no evidence that the COVID-19 vaccines cause infertility. There have been pregnancies in the female study participants in the vaccine group of both Pfizer and Moderna trials. Some of you may have concerns about the vaccine and fetal stem cells. The mRNA vaccines do not contain fetal cells. However, both Pfizer and Moderna used fetal cell lines to perform tests to confirm that the vaccines were effective. Fetal cell lines are not the same as fetal tissue. So who should get vaccinated? Everyone, 16 to 18 years and older, depending on the vaccine that is available to you. Even if you have a history of severe allergic reactions to something other than vaccines or injectable medications, and even if you have a family history of severe reactions or allergies to oral medications. Who should not get vaccinated? If you have had a severe allergic reaction or an immediate allergic reaction, such as hives, swelling, or wheezing, within 4 hours of exposure to any ingredient in an mRNA vaccine, you should not get it. The key ingredients that can trigger such reactions are polyethylene glycol and polysorbate. If you have had if you've had a severe allergic reaction or an immediate allergic reaction after getting the first dose of the vaccine, you should not get another dose. I hope that I have provided you with some helpful information about the COVID-19 vaccines and you.